As your partner in the future of medicine, Vertisis Custom Pharmacy is happy to provide guidance in the use and administration of medications. In this video, we will provide a step-by-step guide on how to self-administer a subcutaneous injection. A subcutaneous or sub-Q injection is a shot of medication delivered by a small needle into the fatty tissue just below the skin. Sub-Q injections are used for the treatment of many conditions, including diabetes, anemia, and problems with blood clotting. Before beginning, it's important to make sure that you've gathered all the necessary supplies. For sub-Q injections, these include alcohol pads, a disposable syringe, medication vial, adhesive bandage, and a sharps container. Once you've gathered all your materials, it's time to choose an injection site. On a human body, the most common site for a sub-Q injection is the abdomen because of its relative ease of access. Now it's time to check your syringe and needle. A syringe consists of 3 parts: the needle, the component that pierces the skin and inserts into the muscle, the barrel, the chamber that holds and measures the medication, and the plunger, the component that controls administration of medication. Be sure to check the needle gauge and length. The gauge refers to the diameter of the needle. The larger the gauge number, the smaller the diameter will be. The length is measured in inches and is typically dependent on the size of the adult. It is important to dispose of your syringes and needles correctly. Needles and syringes should not be thrown in general trash, are not recyclable, and are subject to state laws regarding proper disposal. You may receive or need to purchase a hard plastic container made specifically for used syringes and needles. In a pinch, you can use a soda bottle or some other plastic bottle with a screw-top lid. Wash and dry your hands thoroughly before handling the injection supplies. Don't use a syringe that has been previously opened, used, or damaged. Always use the exact dose that you've been prescribed. Don't allow the needle to touch anything other than the medication vial. Do not remove the cap until you're ready to insert the needle. Some medicines will require reconstitution prior to use. Always follow the instructions provided by the pharmacy or your medical professional. Seek professional advice if you're unsure about any step. Remove the cap from the medicine vial and clean the rubber stopper with an alcohol swab. Check the package containing the syringe. If open or damaged, discard and choose another. Remove the cover from the syringe and hold as you would a pen. Pull back on the plunger to draw air into the syringe to the same volume as the dose of liquid you will be using. With the vial on a flat surface, insert the needle into the rubber center and push the plunger to expel the air into the vial. With the needle still in the vial, turn it upside down. Ensure the needle tip remains covered by the liquid in the vial. While holding the vial upside down, pull back on the plunger to draw the liquid into the syringe, ensuring you draw the correct dose. Check for air bubbles by tapping the side of the syringe. Depress the plunger slightly to expel any air. Double check you have the right dose of liquid in the syringe, then remove the needle from the vial. Choose your injection site. The most common site for a sub-Q injection is the abdomen because of its relative ease of access. However, it's always a good idea to switch up the injection site to prevent any skin irritation and scarring. Grab a pinch of skin between the thumb and forefinger of one hand and clean the chosen site with an alcohol swab. Let the site dry for 5 to 15 seconds. Position the needle so it's pointing straight, a 90-degree angle, at the site. In a firm, smooth motion, push the needle directly into the skin, between the skin and the muscle below. Slowly use the plunger to administer the injection. Count to 3 to be sure it's been completely injected. Pull the needle straight out and apply the adhesive bandage. Throw your needle into the sharps container. We hope that this video has been helpful. As always, please check with your healthcare provider before administering any medications. If you have any questions about this video or any Vertisis products, give us a call at 1-888-285-5841 or visit us at www.vertisis.com. Vertisis Custom Pharmacy, your partner in the future of medicine.